Today we are discussing about the ailments of ARS in ulcerative colitis patient. Usually the issues begins after having ill effects of vegetable diet, especially melons or watery fruits in general. Gastric derangements from cold fruits, eating ice or ice creams or drinking ice water, etc. And those foods may appear acidic or insipid or too salty. And ARS is one of the most important gastric remedy or a great remedy for stomach poisoning or food poisoning, and usually aggravation after alcoholism or after tobacco. And at the same time, one of the specific or characteristic symptom of our patient is patient having great craving for milk. And after having all this food, you can see your patient will have either vomiting or purging. And ARS patient about the stomach symptom. The stomach symptoms, in stomach symptom, our patient cannot bear the sight or smell of food. Anxiety, usually our patient is having anxiety at the pit of the stomach because of there is severe burning pain in stomach, and at the same time our patient craves acid or coffee and heartburn with long-standing irritation and vomiting of blood or bile or stomach extremely irritable. Even with pain in abdomen, the patient craves for acidic food or a coffee, and along with that there is severe heartburn, that is very long-standing heartburn with irritations, vomiting of blood, etc. can be seen. And about the abdominal symptom, gnawing and burning like abdominal pain, and the burning is as if coals of fire were applied over the affected parts, and all these burning issues are relieved by heat or hot applications or after having hot drinks. And along with the, if our patient is having such symptom, along with the GIT problem, there may be some liver and spleen enlargement can be also seen, and that may lead to some painful issues in relation with the splenic and hepatic areas. Abdomen is so swollen and painful. It may be in either local or general peritonitis. Then bloated abdomen is there, but ineffectual inclination to vomiting. Ineffectual inclination to evacuate the content that can be seen. And all these issues are aggravation after alcoholic abuse or after having spoiled or bad food, bad non-veg food. Then painful about the rectal symptom. Painful spasmodic protrusion of the rectum. That means there may be due to the tenesmus or due to the issues, the rectum may get prolapsed. More than that, tenesmus is there, then burning pain and pressure in rectum and anus. Then hemorrhoid, if there is hemorrhoids are very burn like fire and relieved by hot applications or hot water or hot sitz bath. And on examination, the skin over the skin in and around the anal area, there may be exploration of the skin can also be seen. And regarding the stool of our patient, the stools are very offensive, very pungent and very dark with a marked prostration after defecation. And all the GIT issues are usually worse at night and after eating. And after eating and drinking, he immediately wants to move to the toilet. And burning pain in abdomen is also with him. And diarrhea and dysentery, diarrhea soon provoked by either by eating or by drinking with mucus and blood in stool with excessive gas can be seen. So, most of the complaints are aggravation after midnight and cold food and bad or stomach poisoning or food poisonings, after alcohol, and most of the complaints are ameliorated by hot food or hot applications or heat in general. So keep in mind, if your patient is having symptoms of ulcerative colitis, but at the same time, if your patient is having the typical mental symptoms, then only arsenic can be indicated. And along with all the physical symptoms, if your patient is not having any mental symptom of arsenic, ARS is contraindicated. So while counting the symptom or while getting the totality of the symptom, give due respect over the mental symptom of our patient. Fear is there, prostration is there, thirstness is there, burning sensation is there, periodicity is there. By counting all these symptoms, you can prescribe ARS and you will get a better result by managing the ulcerative colitis. Thank you.